Veronica McNally, as we continue here on Why I Vaccinate, we turn now to Dr. Lynn Smitherman. She is a pediatrician with Wayne Pediatrics. It's really great to have you back on the show again, Doctor.
Thank you very much for having me.
We always appreciate your really good advice. And one of the things that we've been urging parents to do is don't look at social media, talk to your doctor, talk to your pediatrician about what to do about COVID and the vaccine. So, would you just kind of start out and just give us a little update on where we are with regard to this variant and kids getting the variant and how sick they're getting?
Yes, so this Omicron variant has been shown to be much more infectious than the Delta variant. And the interesting thing about it is that people are walking around positive with this Omicron variant and not even realizing it. Some of the symptoms seem to be right now runny nose, headache, fatigue. It could be mild or severe. There's a spectrum, sneezing. But one of the more interesting things is a sore throat. And this time of year, especially with the common cold being around, with the weather fluctuating, people's, allergies start acting up. So they might think that some of these things like the sneezing or the sore throat might be, just an allergy or just a common cold and are not always getting tested. So that's where we are right now. That's the more difficult thing. So it's definitely the Omicron variant is definitely more infectious because people might be having symptoms and not recognizing that that's what they have. At the same time, we're noticing that the hospitalization rates for children with the Omicron variant are higher than previously found. And children might also develop severe illness as well. And again, right now, children have been approved from ages 5 and up to get the vaccine against COVID-19. But it's the younger children that we're worried about that are not able to get vaccinated. And those are the ones that we're concerned about getting the more serious disease, especially with the Omicron variant.
So, how do we protect the younger ones? What do we do?
The best thing to do is to make sure everybody around them is vaccinated. Parents, older siblings, people in the community that they might interact with, grandparents, other family members. That's the best way that we can really protect our young, more vulnerable children. And the other thing is, especially for the newborns, if the mothers have been vaccinated during the pregnancy, those antibodies have crossed the placenta, and that's causing some protection as well, especially for those newborns within the first few weeks to few months of life.
Now, the children that are getting really sick with this new variant, do they have pre-existing conditions or you just don't know who's going to get sick?
Both.
Oh,
You just don't know. So definitely children with respiratory illnesses such as asthma and other common things, cystic fibrosis, children that might have seizure disorders or cerebral palsy, they're definitely more vulnerable. And when they get anything, they're going to get sicker than anyone else. But we're also seeing children that are perfectly healthy get exposed to COVID-19. And you just don't know with these healthy children who's going to develop very severe symptoms and who won't.
now when they do develop the really severe symptoms and they have to be hospitalized, how are they treated? What's the best way to treat this for them?
So for right now, is support what we call supportive care. So we want to make sure that we control the fever. So we'll give medications to reduce the fever. We'll also make sure that they don't become dehydrated. So IV fluids might be given as well. And then if they need a little bit of extra oxygen or something like that, we'll do that also. For very ill children with significant underlying health conditions, there have been some newer medications last week that have been approved, but that's really kind of on the back burner. We're talking about children with very, very significant underlying medical conditions or with really vulnerable immune systems that might be eligible for those.
And Veronica, I know you've got some questions too for the doctor.
Dr. Smitherman, last week the CDC expanded its recommendation for kids aged 12 to 17, indicating that they should receive a booster. Can you talk about what parents need to know?
I think that that's actually a good thing. And when you think about, especially with the more recent recommendations by the CDC when it comes to isolation and quarantine, that's based on individuals who've gotten 2 doses of either Moderna and Pfizer and booster. They feel that that boost has been very helpful, especially with this Omicron variant. They think that those that have gotten the booster shot are going to be more protected against this Omicron variant than those who have just gotten just the 2 doses of Pfizer or 2 doses of Moderna or the one dose of Johnson and Johnson. The other thing is you also have to recognize that it's only the Pfizer vaccine that's been recommended for children under the age of 12. So that's something also to recognize as well, because I've had some parents question whether or not the Moderna would be available. And at this time, they just don't have the data to support its efficacy. In other words, how useful it is and how protective it is, as well as the safety. So for right now, the most data we have is based on the Pfizer vaccine. And that's why it is approved for children age 5 and up.
When you see kids in the hospital, and they are obviously very sick from COVID-19, are they vaccinated or not vaccinated?
The majority of children with severe symptoms secondary to COVID-19 are unvaccinated.
So we know that this vaccine is less effective against this new variant, but is it accurate to say that it is still effective?
Oh, yes, it's definitely effective because, again, the vaccine helps your body recognize the spike protein and on the virus. And everybody remembers what it looks like a soccer ball with these little spikes coming out of it. And that's what the vaccine is attacking when they see that spike protein. Now, there's variations in that spike protein depending on the variant of the actual virus, but it does offer some protection for sure. And they have found that even with the Omicron variant, if you are fully vaccinated, the likelihood of you getting severe illness is a lot less if you're fully vaccinated.
What do you want parents to know about myocarditis? And I ask because I understand that there's a risk of myocarditis from the COVID vaccine, but there's a higher risk of myocarditis from getting the actual infection.
Exactly. So, again, it's that balance between risk and benefit. So, what they found with the myocarditis, they've seen it in usually adolescent and young adult males, and it usually occurs after the second dose of the vaccine. And what they have found in these individuals, and it's maybe like out of a million males that have been vaccinated, about 54 will develop myocarditis. And basically, what myocarditis is irritation and inflammation of the heart muscle. From the vaccine, what usually happens is that there might be some fatigue, a little bit of shortness of breath, the inability to do normal activities without feeling tired. And if that occurs, usually what happens is that you go in, get assessed, evaluated. You might need some IV fluids. You might need some medications to help with the inflammation and maybe just a little bit of oxygen. What they found, if the myocarditis occurs from the vaccine, that most symptoms resolve in less than a week, maybe about 2 to 3 days. And then gradually the kids get better and they're fine. What they're finding, though, with children or anybody who gets myocarditis from the actual COVID-19 vaccine is that the symptoms are much worse. Hospitalization will definitely have to occur. You're going to have these symptoms for a much longer time, and the recovery time is going to take a lot longer. And the problem is that you might have lifelong effects from that myocarditis after, if you get it from the COVID vaccine, and I mean from the COVID-19 infection, not from the vaccine.
So the infection from COVID-19 is it sounds like the myocarditis is much worse than
Exactly.
any myocarditis that the individual would get from the vaccine. Very rare side effect.
Very rare side effect. And from the virus itself, much worse.
When parents come in with questions, it's my understanding from the CDC that the most common concern that parents have is the potential long-term side effects from this vaccine. What do you say to parents who present with that concern?
I understand the concern. I understand it's a valid concern. And we only have maybe just over a year experience with this vaccine. However, from the studies that they've done and the trials that they've done, they haven't seen long-term side effects from the vaccine. So right now, again, we're all watching very, very closely and we're all, being very cautious. But for right now, we haven't seen anything that would prevent us, or at least get the medical professionals worried about people not being vaccinated. What we're more concerned is about the long term effects of having the COVID-19 infection itself. And we talk about long COVID in adults where they have symptoms for months and months after the fact. We even see long term effects in children as well. And one of the other things that we see in children is the multi system inflammatory syndrome that can happen maybe anywhere from 2 to 6 weeks after the actual infection itself. And again, you have high fevers, you can have damage to your kidneys, damage to your lungs, damage to your gastrointestinal system, and that can take a very long time. Most of these children need hospitalization, many of those need ICU care. And so we're more worried about the actual infection itself than the vaccine.
What about kids who've had COVID-19? Do you still recommend that they get vaccinated?
Absolutely. We still recommend that because there's no guarantee after you've had the infection that you won't get reinfected. And at least with the vaccine, even if and they usually say, wait, about a month or so after you've had the infection to go ahead and get vaccinated if you weren't vaccinated ahead of time. The reason being is that if you get infected again, those side effects will be much worse. If you're unvaccinated, if you were severely affected the first time, you could get severely affected again, and you're more at risk again for the long COVID symptoms down the road.
Really great information, Dr. Smitherman. Thank you so much for answering these questions. I know parents want to keep their kids in school, they want to keep them in activities, and vaccination is the best way to do that.
Vaccination is the very best way to do. And I really tell parents, if you have any questions or concerns, please talk to your doctors, talk to your pediatricians. There's a lot of really good information out there. And our goal as pediatricians is to keep every child safe and healthy.
So, Dr. Smitherman, before we let you go, one more question. When do
Sure.
you think we will see a vaccine for that age group 4 and younger?
From the data that I've seen, it looks like maybe sometime towards the end of the summer, we might be seeing something. So hopefully prior to the next school year, we'll be able to get everybody vaccinated.
Wonderful news. Dr. Lynn Smitherman, a pediatrician with Wayne Pediatrics, thank you so much for this really helpful and interesting information. Very important information for our parents out there. Thank you.
Thank you for having me.
You are listening to Why I Vaccinate. We'll be back right after this.